Let's talk about direct porcelain veneer provisionalization. Now, as you know from past Dental Minute videos, I like to use a matrix from the wax-up model to fabricate indirect porcelain veneer provisionals, and then you can add little bits once you get to the mouth. But what if you've got a single tooth, say a tooth like this that has in which the porcelain veneer is fractured? In that case, you don't want to make the provisional from a matrix. You want to fabricate the porcelain veneer provisional directly on the tooth, and I'm going to show you how to do that. First, I've cleaned the tooth with pumice and water, and then I put 2x2s behind the tooth to isolate it and clean it with isopropyl alcohol on a cotton ball. Then I'm going to rinse that off and dry it off with my air syringe. Now, if there's any bleeding, don't use water from the air-water syringe. Use a bulb so that there's not a lot of pressure to rinse the alcohol off. Then we're going to dry it. Now I'm wetting my finger, or the glove part of my finger, and putting my finger behind the tooth. The objective is I want to squirt the bisacrylate into the interproximal spaces between the tooth, but I don't want it to blob out or flow out way onto the palatal. And that's what my finger does. It blocks it right there, but it allows the bisacrylate to flow into the interproximal areas for mechanical retention in the interproximal spaces. And I'm just flowing this on, not getting real close to the margin. So we let that sit, and that's just kind of the body part of the provisional. Then I'm going to come back with flowable composite and fill in the margins or any voids and be sure that there's material in the interproximal area. Now I'm going to smooth that out, just pull it into the interproximal spaces, fill in the voids, and have just a little bit of overbuilding in the marginal area, because I'm going to come back and polish that here in just a moment once it's set. Okay? Then once I've cured it, this is a Brasileir small flame-shaped fine diamond. I'm going to do the general contouring with that diamond, being careful not to touch the tooth. I don't want to cut the tooth, and so since it's just the tip part, the very tip of the diamond that would be on the tooth, because the angle's about like this, you really don't have to worry about cutting the tooth. And go away from the cutting direction of the diamond. You know, when you pull the diamond towards you, it cuts deeper and can gouge. Whereas when you go away from you, it smooths because you're not pulling it into the cutting aspect of the diamond. So just generally contouring, smoothing, contouring the margins. Then this is a finishing and polishing disc. Again, just contouring. Squirt water as I'm using that disc. And now I'm finishing with the Brasileir 12 fluted burr. Just refining the margins and the interproximal area and the incisal interproximal contacts. Again, I'm going away from the gouging direction of the burr. If you move it this way, it's just smoothing, whereas if I go this way, it can dig in. So go in the smoothing direction. This is a Shofu rubber wheel on the palatal. This is excellent because it won't cut tooth, but it'll remove any areas in the interproximal that have come through too far. It's also very good for refining the incisal palatal line angle. Then check the occlusion. This is a very good occlusion paper. It marks wet, Bosch, and there we have it. Now that took about that long, and it's very strong, durable. I don't use this procedure unless I'm just placing one porcelain veneer provisional. More than one, I use the matrix technique on the wax-up that you've seen in other videos. And that's the Dental Minute.
Hey y'all, I know you loved this episode of the Dental Minute. Make sure you press subscribe subscribe if you have not already, and get fired up because next week we are talking about mini implants to secure a maxillary denture. You will not want to miss this episode. See you next week.